What class does a vasodilator belong in? Antihypertensives. Side effects include cardiac arrest, bradycardia, angina, and pulmonary embolisms. Antihypertensives. What lowers the blood pressure? What class of drugs lowers the blood pressure? Antihypertensives. ACE inhibitors, calcium channel blockers, beta blockers, and vasodilators are what type of med? Antihypertensives. Sodium restrictive diets are for patients on what med? Antiarrhythmics. No antacids within 2 hours of taking what medication? Digoxin and Lanoxin. What class are these? Antiarrhythmics. What treats chest pains? Antianginals. What can increase blood pressure fast but cause a severe headache? Nitroglycerin. What is nitroglycerin? An anti-anginal. Name a potassium-sparing diuretic. Spironolactone or aldosterone. What diuretic requires potassium-rich foods and has a sodium restriction? Furosemide or Lasix. What type of diuretic is this? A loop diuretic. 20 milligrams per minute for what diuretic? Lasix or furosemide. How many mils of ibuprofen in 24 hours? 2,400. What is ibuprofen? It's an NSAID. Which steroid do you not stop abruptly? Medrol. What antiarrhythmic drug is given IV? Lidocaine. Name some antiarrhythmic drugs. Digoxin, Lanoxin, or lidocaine. What regulates the heart rate? What class of drugs regulates the heart rate? Antiarrhythmics. Name 2 steroids. Salumedrol and Medrol. What class is Salumedrol? Anti-inflammatory. What does nitroglycerin do? Decrease the blood pressure. What do you monitor with heparin? What blood test do you use to monitor this? What blood test do you use to monitor clot formation in heparin? PTT. Respiratory depression lowers blood pressure, drowsiness, and constipation. These are side effects of what class of drugs? Respiratory depression, it lowers the blood pressure, drowsiness can occur, and you will get constipated while taking these medications. Analgesics, opioids. What causes rays in children? Aspirin. What are the side effects of beta blockers? What happens to the blood pressure anyway? It decreases. What happens to the heart rate? It slows. What other side effects do you get? Could you get? Cardiac arrest, chest pain, and pulmonary edema. What do you monitor with beta blockers? Blood pressure and pulse. This treats VTAC, VFib, and PVCs because it regulates the heart rate. What is it? What class of drugs is it? Antidysrhythmics. What do you not take with digoxin or lanoxin? Antacids. What cardiovascular drug must you monitor blood levels for because of the toxicity? IV lidocaine. Name an ACE inhibitor. Lisinopril. Hypertension destroys what? What organ? The kidneys. What's the antidote for heparin? Protamine sulfate. Heparin. Protamine sulfate. How do you give Lovenox, aka enoxaparin? Sub-Q injection only. Another name for Lovenox. Enoxaparin. What class is enoxaparin? It's an anticoagulant. How do you take warfarin? It's the only way you can take warfarin. By mouth. What's the antidote for warfarin? Vitamin K, because it clots. Another name for warfarin. Coumadin. What do anti-inflammatories do? Or what do they help with? Or, yeah. Anti-inflammatories do what? Decrease edema. Name some opioids. Codeine, Demerol, and morphine. Name a combo analgesic. Percocet and Lortab. What are steroids used for? Severe inflammation. What blood test do you do with warfarin? PT and INR. What are the heparin blood tests? PTT. Beta blockers are hypertensives. What do the meds end in? LOL or press? Low or press? Low as in metoprolol or press as in catapress. Those are your beta blockers. ACE inhibitors are antihypertensives. What do the drugs end in? Prils. Where is ibuprofen excreted? What organ? Ibuprofen. The kidneys. What anticonvulsant is used as an adjuvant to help narcotics work better? A Neurontin or gabapentin? Neurontin or gabapentin? Okay, so what do beta blockers do? They decrease the blood pressure. Drugs ending in LOL are what? Beta blockers. Name some analgesics. There's two. Acetaminophen or Tylenol or aspirin. And aspirin. What's patient teaching for antihypertensive drugs? You want to take them after meals. You want to report fainting or dizziness because this means blood pressure is too low. And then you want to monitor blood pressure or show them how to take their blood pressures. What do vasodilators do? Open the veins. What makes up Percocet? Oxycodone and acetaminophen. Name some anticonvulsants. Dilantin, phenytoin, or Neurontin and gabapentin. What do you need to monitor with anticonvulsants? Blood levels. Slurred speech, eyes move back and forth, and it turns the urine pink. And they also have furry teeth. What drug are they taking? It's a anticonvulsant. It's an anticonvulsant. What anticonvulsant causes slurred speech, the eyes to move back and forth, and turns the urine pink? Dilantin or phenytoin. You want to give with food. Diplopia is a side effect, and you want to monitor the blood levels with this anticonvulsant. Neurontin or gabapentin. What treats PVCs and tachycardia? Antiarrhythmics drugs. All right.